Hello, my Pharma friends and my dear students. My name is Sachin Jadhav, founder Fundamental Pharmacy, author of Fundamentals of GPAT Niper DI Pharmacist Volume 1, GPAT Cracker Achiever MCQ book, and author 4 books. Welcomes you in this video session. In this YouTube video session, we are going to see part second of your how to prepare for GPAT 2023-24 exam. So those who have not been seen previous part 1 video on GPAT preparation, please go and watch that video. The link of that video will be available in the description box. And today we are going to see part second of GPAT 2023-24 preparation. So let's start the video. We have seen in the previous session these points: importance, benefits, how to start pattern, what is the pattern for exam, how to divide the syllabus, which subject you have to choose, which subject you have to read first, and how you have to read. Okay, we have seen that part, and we have also seen the different section of your GPAT paper, different section, and how many questions they are going to ask you in from these different section. We have also seen the time management. We have also seen the special tips for exam, and now today we are going to see the part second of that. So here is the part second: how to study MCQs. So a lot of students, they used to ask me, sir, how to study the MCQs. I used to answer them in a very simple way. You can easily cover up your syllabus by just reading the MCQs. But how the manner of studying MCQs should be different. Okay. So most of the students, they used to do what thing? They used to do what? They just used to read the MCQ. They just used to read the correct answer and that's it. But this should be not a way, or this should be not a approach. So what you have to do? Suppose that in front of you there is one MCQ. Okay. So which anti-inflammatory drug is a selective COX-2 inhibitor? So few students, they might know the answer of this question, but you should not stop here. You have to read each and everything regarding all options. You have to recall each and everything about the all options. For example, so the question is like this: which anti-inflammatory drug is a selective COX-2 inhibitor? Your options are acetaminophen, option B nimesulide, option C diclofenac, option D celecoxib, option E navametone. So there are five options. So correct option is option D, that is celecoxib. And most of the student knows the correct answer, but you should not stop here. Okay. Now what you have to do? You have to recall regarding each and every options. Now what is the first option? Acetaminophen. So acetaminophen is, what is it? It is nothing but the paracetamol. Okay. So paracetamol. So try to recall each and everything regarding paracetamol: the class of drug, then the mechanism of action, then the pharmacological actions, then particular uses, then what are the specific adverse reactions. So try to recall these things regarding all options. Now let's come to the first option, that is the acetaminophen or paracetamol. So paracetamol is nothing but the para-aminophenol derivative. It comes under the para-aminophenol derivative. Okay. Now it is again analgesic and antipyretic drug. Remember, it will not have this paracetamol has a very weak anti-inflammatory activity. So it is a weak anti-inflammatory drug. So it is ineffective in presence of the inflammation of the tissue. It is a ineffective in presence of the peroxide present in the inflamed tissue. So this paracetamol is a very weak anti-inflammatory activity. Now it is a analgesic and antipyretic. Now what is the mechanism of action? So it is a COX inhibitor. It is a selective COX-3 inhibitor in the brain. Okay. So COX inhibition, equally the COX is inhibited by this paracetamol, that is a COX-3 enzyme, and in the brain, and that inhibition of COX-3 is also responsible for its antipyretic effect. Remember this. Okay. It has a very weak anti-inflammatory activity. It is ineffective in case of inflammation, because in case of inflamed tissue there is a peroxides. In that presence of peroxide, this paracetamol becomes ineffective, and that's why it has a very weak or weak or no anti-inflammatory activity. Okay. Second point. Third point is What is the use of this paracetamol? So paracetamol is used as a analgesic and antipyretic. Okay, antipyretic means that drug will increase the body temperature. Okay, so it is an analgesic and antipyretic, not an anti-inflammatory drug. Now let's come to the adverse effect. So what are the adverse effect? Okay, so major important adverse effect of paracetamol is a hepatotoxicity. Okay, hepatotoxicity, but it is not in a normal dose. If you take paracetamol 500 to 1 gram daily, so you will not feel any kind of adverse effect, or you will not experience any kind of adverse effect. So if you use paracetamol beyond the therapeutic doses, okay, so what is the normal dose? That is 500 to 1 gram per day. Okay, that is a normal therapeutic dose of paracetamol. So if you take beyond this, suppose that if you take 6 more than 6 gram of paracetamol per day, so that is going to be toxic, that is going to show you adverse effect. So now what kind of adverse effect? That is nothing but the hepatotoxicity. Okay, so hepatotoxicity, that means what? It will react with the hepatic cell and it will cause hepatic cell necrosis. But why this paracetamol is a hepatotoxic? So let's come to that point also. If you take 6 gram of paracetamol per day, now most of the that paracetamol, now that will be converted into one, that metabolite is known as para hydroxynaptoquinone imine. Para hydroxynaptoquinone imine. Now that metabolite reacts with the hepatic cell and causes hepatic necrosis, that means hepatic damage. That is the hepatotoxicity. Okay, now if you take paracetamol beyond the 6 gram per day, then only that reactive metabolite is generated in your body, and then only the paracetamol becomes hepatotoxic. Normally what happens, the metabolism of paracetamol involves a conjugation reaction, that is a glutathione conjugation reaction. So if you take paracetamol in a normal dose, so your body's glutathione reserve is normal, and at that time paracetamol metabolites are easily excreted from the body. But if you take beyond the 6 gram per day, so at that time your glutathione storage of your body gets saturated, and it is a and that time there is a depletion of that glutathione, and that's why that toxic metabolite is not eliminated from body. So normally what happens, that toxic metabolite is generated, but they are easily removed from body because of the glutathione conjugation reaction. But in toxic doses, that is beyond the 6 gram, so glutathione storage of your body get depleted. Okay, and now it will show hepatotoxicity. Now what you have to done, you have to do in case of hepatotoxicity. So what is the measures to overcome? So what is the specific antidote for that paracetamol intoxication or overdose? So that is known as a N-acetylcysteine, NAC, N-acetylcysteine. So that is a sulfur containing amino acid which will provide the sulfhydryl groups, and which will provide sulfhydryl groups and increase the glutathione storage of your body, so that the toxic metabolite can be easily removed. So N-acetylcysteine is a specific antidote for paracetamol toxication. Or another sulfur containing amino acid like methionine is also a antidote for that. So don't get confused that only N-acetylcysteine is an antidote. So methionine is also antidote. So sulfur containing amino acids, they used to provide sulfhydryl groups, and which are the which will increase the glutathione levels of your body, so that the toxic metabolite of paracetamol can be easily removed from body. So you have to go in this manner. Next option is Nemoslide. So Nemoslide is a naphthalenic acid derivative. It is again a analgesic, antipyretic and anti-inflammatory drug. It is a very good anti-inflammatory drug, but most of the countries have ban on this drug. Why? Because it has a severe fulminant hepatotoxicity as an adverse effect. Now India has also banned this Nemoslide in the children's under 12 age. So no children's, pregnant woman, lactating woman should be prescribed with this Nemoslide because of that fulminant hepatotoxicity. Okay, and Nemoslide also has a one adverse effect known as a hepatotoxicity as well as nephrotoxicity. So because of nephrotoxicity and hepatotoxicity, and nowadays most of the countries have ban on this Nemoslide. Okay, so you should read in this manner. Now let's come to the third option. That is nothing but the diclofenac. So diclofenac is nothing but the aryl acetic acid derivative. Aryl acetic acid derivative. Okay, the class. Now it is an analgesic, anti-inflammatory, and antipyretic drug. What is the adverse effect of this drug? So this diclofenac will irritate your stomach, will irritate your GIT, and will cause hyperacidity. So hyperacidity is the adverse effect. So that's why this diclofenac is always prescribed with either proton pump inhibitor or ES2 receptor blocker. Okay. Then again, this diclofenac is also used in the different kind of pains, inflammation, and pyrexia. The uses are very important. Then this drug is also used in the veterinary practices. Okay. So you have to read in this manner. Now let's come to the option D, celecoxib. So all the coxibs, celecoxib, itrocoxib, refacoxib, valdecoxib, and all the coxib family, they are known as a selective COX-2 inhibitor. See, there are different enzymes, COX-1, COX-2, COX-3. COX-1 is known as a constitutive, COX-2 is known as a inducible. Okay, so COX-2 is inducible, means it is induced in presence of pain and inflammation. Okay, so selective COX-2 inhibitor, they are very beautiful analgesic, antipyretic, anti-inflammatory drug. They are very beautiful anti-inflammatory, but most of them, they have been withdrawn from the market because see, they are selective COX-2 inhibitor, and selective COX-2 inhibition causes adverse, that inhibition of COX-2 enzyme adversely affect the cardiovascular system. So like rafacoxib and valdecoxib, these are the two drugs that increases the myocardial infarction, that increases the threshold of myocardial infarction. That means they produce the myocardial infarction, they can produce the arrhythmia, and that's why most of the coxibs, they have already banned. Okay, they have already withdrawn or banned. Now let's come to the option E, that is naprometon. Naprometon is again a naphthalenic acid derivative. It is also analgesic, antibiotic, and anti-inflammatory drug. It is a preferential COX-2 inhibitor. Nimesulide is also preferential COX-2 inhibitor, and this naprometon is a prodrug. It is converted into body into active metabolite. That is a 6-methoxy naphthalene, 6-methoxy metabolite. Okay, so you have to study MCQ in this manner. Now let's come to the second MCQ, which dosage form is prepared in the clinical trial. Okay, so it is a logical question and you have to answer by you are using your logic. So option like tablets, then option B capsule, option C injections, and option D liquid orals. So now our correct answer for this question is option B, capsules. So capsules are the dosage form which are commonly used in the clinical trials. That doesn't mean other dosage form are not used. Other dosage form also used, but commonly capsules are used. Now what is the reason behind that? I will explain. See, in case of tablets, you have active drug plus excipient, okay, mixing, granulation, then compression. So a lot of kind of forces are also involved. Compression forces involved. Okay, so drug excipient interaction might be there in case of tablet. So drug excipient interaction while granulation hydrolysis may take place. Okay, so either drug is incompatible with either one or more excipient or colorant or solvent used for granulation. Okay, so there are chances of drug excipient interaction in the tablet. Now in the capsule, what you are doing, so you are just enclosing the drug alone or drug with excipient in a empty gelatin shell capsule, so which is inert capsule. Okay, so here you can enclose drug alone, okay, or with excipient. So there is no drug excipient interaction, much much drug excipient interaction in case of capsule. Okay, so capsule is very convenient dosage. Okay, so that's why capsule is mostly used in the clinical trials. Now let's come to the injection. So injection, what is it? It is nothing but the drug plus solvent plus preservative and all that. Okay, so drug in a solution or any kind of solvent is prone to hydrolysis, oxidation, and all that, so degradation and all that. So drug excipient interaction is again there in the injection. Same is true with liquid orals also. So that's why capsule has a minimum drug excipient interaction. If excipient are used, then only, okay, and if excipient is not used in the capsule, then it will not have any kind of interaction. It is an inert dosage form. Okay, so that's why capsule is a more convenient and more readily available dosage form, and that's why capsule is mostly used in the clinical trials. Now let's come to the another question: which polymer is suitable for coating of tablet if desired target of drug release is in a intestine? Now they have asked the question. What are the options? Option A, HPMC, that is hydroxy propyl methyl cellulose. Option B, pre-gelatinized starch. Option C, cellulose acetate phthalate, that is cap. Then option D, PVP, polyvinyl pyrrolidone. Okay. Now they are asking which polymer is suitable for coating of tablet if desired target of drug release in a intestine. So option A, the correct answer of this question is option C, cellulose acetate phthalate. Why it is correct, I will explain. Now let's come to the option A, HPMC, hydroxy propyl methyl cellulose, cellulose derivative. Okay, so HPMC is a multi-purpose tablet diluent. Remember, it is a multi-purpose tablet diluent. It is used as a binding agent. It is also used as a film former. It is also used as a disintegrant. So it is a multi-purpose diluent, tablet diluent. Okay, remember that was a question in GPAT 2019, I think. Film former. HPNC is a film former. Okay, so you have to remember or you have to recall each and everything about the HPMC. Now let's come to the option B, pre-gelatinized starch. So starch is also used as a binding agent. Then it is also used as a disintegrating agent. Okay, so then let's come to the option C, cap, cellulose acetate phthalate. So now this cap or cellulose acetate phthalate is nothing but the pH dependent polymer. Okay, pH dependent polymer means the solubility of this polymer will change depending on the changing in the pH. So at the acidic pH this is a insoluble, and at the basic pH it is a soluble. So this cellulose acetate phthalate is used to coat the tablet if entry coating is desired. So entry coating means what? That tablet will bypass the stomach. That tablet will not break in the stomach. That will release the dosage in the intestine. Okay. So in the acidic pH, the coating or the film which is formed by cellulose acetate phthalate will not break down, will not dissolve, and when it will go to the intestine at the basic pH, the film formed by cap will get dissolved and there will be a release of drug. Okay, so that's why cellulose acetate phthalate is a pH dependent polymer and it is used for the coating of enteric. It is used as a film former in case of enteric coating tablet when the desired release of drug is in the intestine, so it will bypass the stomach. That's why the answer is option C. Now PVP is again a tablet diluent by polyvinyl pyrrolidine. Okay, it is a tablet diluent. So you have to read in this manner. We will take another slide for MCQ. How to study MCQ. Okay, so identify the structure of beta blocker in given image. So here is in question in front of you. That is identify the structure of beta blocker in given image. Okay, or given structure. So they will give you one structure and they will ask you to identify the structure of drug. Such kind of questions they have started asking in the GPAT exam. Okay, so in this type of question or in this condition, what you have to do, you have to just try to focus on your heterocyclic ring present in the structure. Okay, now if you focus the heterocyclic ring present in the structure, that is nothing but the indole over here. Okay, indole. So you can see indole ring is there. So just try to correlate that indole ring with the options. So what are your options? Option A, propranolol. Option B, bisoprolol. Option C, pindolol. Option D, atenolol. These are the different options. So the structure is of pindolol. But you should not stop here. You have to recall each and everything, or you have to read each and everything. So what is the propranolol? So what kind of ring is present in the propranolol? Okay, so in the case of propranolol you have naphthalene ring. Now in case of bisoprolol, what kind of ring is present? Okay, or what kind of specific groups are present? So sulfoxide. In case of pindolol you have indole group. In case of atenolol you have phenoxy ring. Okay, so you have to read the MCQ in this manner. Now again see question number 5. Sudden infant death syndrome is a metabolic disorder of options are carbohydrate metabolism, protein metabolism, lipid metabolism and amino acid metabolism. So this question I think already asked in GPAT 2019. So if you have read beta oxidation of fatty acid, the question is related with that. So sudden infant death syndrome is because of the blocking of beta oxidation of fatty acid. So sudden infant death syndrome is a metabolic disorder due to blockage of beta oxidation of fatty acid. And beta oxidation of fatty acid is the metabolic pathway for lipid metabolism. So now what happens soon after the soon after the delivery of your baby, soon after the delivery of newborn, so its lipid metabolism should start. So whatever nutrition he has or the baby has from mother, so now that is diminished, that is abolished. Now its fatty acid metabolism should start. For energy, the metabolism beta oxidation of fatty acid should start. If the beta oxidation of fatty acid is blocked due to some genetic defect or due to blockage of that enzymes required for beta oxidation of fatty acid, the sudden infant death syndrome is there. That is nothing but this. So option is option C. Sudden infant death syndrome is a metabolic disorder of lipid metabolism. Now question number 7. Question number 6. Hemocrit above 48 to 50% will result in. This was also a question in GPAT 2020. So options are anemia, polycythemia, option C thrombocytopenia, option D prothrombonemia. So this is a question from your blood chapter from anatomy physiology. So hemocrit, first of all you should need to understand what is hemocrit. So hemocrit is nothing but the packed cell volume of RBC, red blood cell, volume of red blood cell in the 1 liter, volume of red blood cell in the 1 liter, that is nothing but the hemocrit. So normal value of hemocrit is a 45 to 50% in the male, okay. In the woman it is again 35 to 45%. Now if hemocrit value is less than normal value, so that result in the anemia. Then anemia means decreased oxygen carrying capacity of your blood, that is anemia, or decreased hemoglobin in the blood, that is anemia. Hemocrit value less than normal result in the anemia. Hemocrit value more than normal result in the polycythemia. So hemocrit value less than normal, I think almost each and every student they was aware regarding this. So if there is decrease in the hemoglobin content or hemocrit value, that result in anemia. But most of the student was not aware about this. So increase in the hemocrit value or RBC, that is nothing but the polycythemia. So answer of this question is option B polycythemia. Now what is thrombocytopenia? Decreased in the thrombocyte level of the blood, that is the thrombocytopenia. Now what is the prothrombonemia? So increased in the prothrombin level of the body, that is known as a prothrombonemia. Okay, so you have to read in this manner, you have to study the MCQs in this manner. A lot of students they used to ask me, sir, for GPAT and Niper, whether classes are important or not, whether classes are absolutely necessary or not. Now my typical answer for those students, see, if you have guts, if you have talent, if you can work hard, there is no need to join any classes for GPAT. GPAT is a very simple exam and you don't need any classes. But still, if you think your study is not going properly, if you need guidance, if you need if your college is not good, if your college teachers they are not teaching well, or any other problem, then you can join the classes. You should not expense a lot of money in the classes, okay. Those classes which are available below 10,000, that is okay. So 20,000, 30,000, that is not a 20,000 per year for GPAT is a very big amount, and you should not spend your money, okay. So we also have our classes of fundamentals pharmacy, that is GPAT Niper 2023 online class, and this class is not only for GPAT. So each and everything regarding GPAT, Niper, drug inspector and pharmacist exam we covered, okay. So in this has a 8,000, in 8,000 rupees for 1 year, and you will get here a live lecture on Wednesday, Saturday, Sunday, online live lecture on Wednesday, Saturday, Sunday. So 5 to 7 p.m. Wednesday, again Saturday 5 to 7 p.m. and Sunday 11 to 1 p.m. and again 4 to 6 p.m. Okay. In case you miss any lecture, same lecture available in the recorded form in our application. The most important thing of our classes, you are getting study material over here in a hard copy. In that is also included in your class fees. That means in 8,000 you are getting online lectures, you are getting study material, you are getting recorded lectures will be available, and unlimited watch hours are there. You are getting test series also. That means in a one batch of 8,000 rupees you are getting each and everything. So lot of classes they used to charge separately for the study material, separately for the test series. I'm not like that. I'm just offering you 8,000 rupees, and in that you will have live lectures also, recorded lectures also, study material also, and test series also. But remember, so if you have guts, if you have if you can sit, if you can do say self study, there is no need to join any classes. You can get a very good rank by doing self study. Now we'll see next, that is a strategy for last year students. So if you are in a last year and you are preparing for GPAT, so now see your GPAT paper has a 5 different sections. Now out of that 5 sections, what are the 5 sections? So first section is nothing but the pharmaceutics, second is a pharmacology, third is a chemistry, fourth one is a cognosy, and fifth one is a other subject. In the pharmaceutics you have engineering, physical pharmacy, industrial pharmacy, biopharmaceutics, dispensing. Pharmacology, that you have anatomy, physiology, biochemistry, microbiology, and pharmacology 1 and 2, 1 to 3. Then in chemistry section you have organic chemistry, medicinal chemistry, analysis, biochemistry, extracts. In cognosy you will have cognosy 1 and 2, and in other subject you have jurisprudence, biotech, management, hospital pharmacy, quality assurance, pharmacy practice, etc., etc. Out you have to prepare for all the sections. Ideally you should prepare for all the sections. You should not skip any section. So most of the students they used to ask me, sir, pharmacology and pharmaceutics are very important, and we should prepare only two. You can do whatever you want, but my advice to the student will be prepare all the sections. If you have 1 year time or you have 7 or 8 months time, so you can prepare all the section. If you want to skip, you can skip any one section, but my advice will be don't skip anyone. Obviously section 1, that is physics, pharmacology, is very compulsory, and out of last 3, that is chemistry, cognosy, and other, so you can skip anyone, but my advice will be don't skip anything. Try to cover each and everything and each and every subject. That will always help you. And again, while studying from reference books, so at least revise. So once you have to read thoroughly from reference book, and now what you have to do, so revise or make a revision of charts, tables, summary, definitions, if any law is there, if any value is mentioned over there, if any theory part is in there, all the content which are given in the bold, those content from reference book are very important. See, charts, tables, summary, definitions, if any value is there, if any law is there, if any theory is given over there, any bold content is written in the bold, so that content is very important. And GPAT MCQs, you may you are able to solve the MCQs by reading these points for each and every respective subject. For every subject from its respective reference book, you have to read these points: charts, tables, summary, definition, value, theory, laws, bold content, and all that. These content are very important, remember. Okay, now we'll see the next point. Next point is nothing but the GPAT books available in the market. So what are the different GPAT books available in the market? Which book you should purchase? So that is again very important questions most of the time I used to face. So what are the different books available in the market? So ideally you should read from various reference books of respective subject. So list of reference book and their respective subject. If you want, you can WhatsApp me on my number. I will provide you the PDF. I have already made that PDF. So one reference book for one subject, or you want more reference book for more subject, for subject, that also I have made. Okay. Now ideally you should read from various reference book of respective subject before reading the GPAT guides. So these GPAT guides are only important for your last 2-3 months study. Now what are the different GPAT books available in the market? So first one is Fundamentals of GPAT Niper DI Pharmacist Volume First, that is written by me only. Then again GPAT Cracker Achiever, that is MCQ book only, that is also authored by me only. So first two books are written by me only. Then GPAT companion is available. In that GPAT companion you will find only previous year's papers and their explanation. Then Pearson GPAT guide is also there. So here also you have some notes and MCQs. Then Piyush GPAT cracker is there. Again same theory and MCQs. Then GPAT Muhammad Ali, GPAT guide by Muhammad Ali is also there. So these are the different GPAT books available. So I don't want to talk with I don't want to talk much on the other books, but I will talk on my books because I know what is the content in the book. Okay, so fundamentals of GPAT Niper DI Pharmacist volume first. So subject wise and chapter wise notes are available. Subject wise, chapter wise MCQs are available. Whatever the notes are there, they are unique tabulated notes made by referring the reference books. So that is nothing but the summary, that is nothing but the extract, that is nothing but the essence of reference books, which I have summarized and I have presented in front of you in this book. Okay, from this book every year around 50 to 55 MCQs, that's that MCQs are covered in the each and every GPAT exam. For NIPER exam, 150 plus MCQs you can expect that will be covered from this single book. And this book is not only for GPAT and NIPER. This book will be help you for GPAT, NIPER, drug inspector, government pharmacist exam. So it is going to be your lifetime book. Okay. Then this MCQ book is also there for MCQ practice. So these are the different books available in the market. So you should if you are thinking to read any GPAT guide, then you must think about this book. That is the fundamentals of GPAT. Now we'll see the next point. That was our second part. Okay. If anybody wants to order these books, they can contact me on my number. My numbers are given on the screen. So you can WhatsApp me on my number. That is 9766654377 to order these books. Or don't worry, you will be given samples. Don't order anything blindly. You will be provided with a sample, like a sample of book in the PDF format, and then if you like the sample, and then only you can order. So don't order anything blindly. So a lot of people they are doing such kind of business over here. Don't order anything blindly. This was our part second of GPAT preparation. Upcoming videos are going to be there. Part 3, how you can prepare for GPAT, part 3 and part 4. As I have told you in very first session, I am going to take this GPAT 2023 preparation in part 4. Two parts are completed, and in part 3 and part 4 we are going to see what are the important subject, what are the important topics from that subject, what are the important points from that topics. Okay, so we are going to see in the third session of this video. So this was a second session. Thank you for your presence, and connect with us. You can connect or you can follow me on Instagram, Facebook, YouTube and WhatsApp. That is my both numbers are given over here on the screen. You can also download our application Fundamental Pharmacy from Play Store. See you in the next video. Thank you very much for your presence.